Does everybody get the first aid list? Yeah, that sheet.
Yes.
And you're gonna pair up, so every pair needs to have these, maybe practice things. All right, I think I know everybody. Those of you who don't know me, I'm David McTee, KJ5MCT. A little bit about me.
Are we recording?
Are we recording? A little bit about me that kind of gives me my creds. I'm a former paramedic and a Navy corpsman. I was a paramedic and taught paramedics for several years when I was in South Carolina, so I kind of kept my hands in the first aid aspect of it. So next slide, please. Sorry. Yeah. There we go. So first thing is, what should you have in your kit? You can go to the next slide after that. And what I've given you is a listing of some of the main things you should have in your kit. Everybody's going to build their own. But the paper is there to just kind of give you an idea of things that you can put in a trauma bag or a first aid kit for your home and your car. A question came up to me a few minutes ago. You see a small cup is on the list. Small cups are used primarily for eyeballs. You know, if you come on an accident or something like that, somebody's eyes popped out, and I've seen that, you can use that cup to kind of put over the eye and then wrap it, because you can't really poke it back in. You know, eyeballs don't like that very much. But these are just some of the things. You make your own kit, but just some of the recommended stuff that we recommend everybody to have. What we're going to do, I'm going to go over just some basic safety stuff that's available to you or that you need to do whenever you're facing the trauma situation. And then we're going to go into different treatments like direct pressure, tourniquets, and stuff like that. I'll show you how to do it. We'll talk about it. And then I'm going to have you practice with your partner in wrapping each other up and putting out. Tourniquets do not go here. You know, so I made a kind of joke that if you put the tourniquet around here and you tighten it, bleeding will stop. But it's not something that you really want to do. So next slide, please. So some golden rules of trauma, or golden rules of first aid, is prioritize safety. You can't do anybody any good if you get injured. You know, like if you look at the picture here, you see that folks are on the street. You got an injured guy down, and where's that lady walking? She's out in the middle of the street.
Yeah.
Is that a safe thing to do? Now, if you look and nobody's coming, then cool. But you know, you got to maintain your own safety because again, if you get hurt, you're not going to be any good to anybody else. That's just going to bring somebody else in. You analyze the situation and the victim. You know, are we in a smoke-filled house? Are we in a fire? Are we up on I-35 with a wreck going on and all that kind of stuff? What's the status of the victim? Are they alert? Are they conscious? Are they bleeding? All that kind of stuff. Are they breathing? I gotta see the video. And obviously call for help. You know, how many of y'all had CPR classes? What's the first thing you do when you walk up on somebody? You know, can you hear me? Are you okay?
Yeah, ABC.
What's next?
Absolute call.
Call 911.
911, yeah.
Okay, 10 points out of petty cash. Okay, you call for help. Call 911. I need some help over here. You call 911, etc. Because you know you don't know if you're at an accident scene or something like that, if they've even been called. I've stopped at accident scenes and waiting, and there's 5 or 10 people standing around. Police and EMS, nobody called. You know, they figure what they called, or he called, or they called. So always identify somebody. Call 911. Tell them what we got. Something along that line. ABCs. What's that?
Say
again.
Can you hear me? Are you okay? Or
What's A stand for?
airway.
B.
Bleeding.
C. Is B bleeding or is it
No.
breathing?
Breathing. It's breathing.
And what's C?
Circulation.
Airway, breathing, circulation. Okay. If their airway's not open and they're not breathing, controlling their bleeding is really not going to help. You know, because you can go, I think, what is it, 4 minutes, 4.5 minutes before you start getting the potential for brain damage on not breathing.
I always work for 3, but okay.
I think it's 3 to 4, 4.5, something. Well, anytime is
Don't
not
matter.
good. Because you got to think about it. You come up on a situation, how long has that person been there?
You have no idea.
You got no idea. Treat for shock. Anybody know some of the symptoms of shock? What is shock? I'm sorry, go ahead.
That's dilated pupils.
All right, pupils could be dilated. What else? What about their skin?
Pale.
Pale, clammy, kind of sweaty, maybe a little disoriented, stuff like that. Start looking for that kind of stuff. And be mindful of any spinal injuries. Why? What's so important about that?
Make things worse. Yank a helmet off a motorcyclist or. something.
Absolutely, especially like in falls, right? Okay, like you had a fall not too long ago, right, Mike?
No,
Somebody had a fall not too long.
Don.
Don, I'm sorry. You know, how many of you ever fallen and bumped your head? See stars?
Well, I can't do
That's
it.
the right answer.
That's the right answer, you know?
Not that I remember.
So, I mean, you come across a fall, you come across an accident or something like that. If you're in a car, you know, hey, let's get out of the car. Come on, pull them out of the car. Well, you could have just broken their neck. Leave them where they are.
Only okay if it's on fire.
Yeah.
Yeah, but there's ways that you can move them that's safe, and we're not gonna get into that. There's ways that you can move them are a lot safer than just grab them by the collar and throw them to the side of the road. But yeah, I mean, and that's where we go back to, you know, the situation,
Situational awareness.
you know, situational awareness. You know, if I'm in an accident scene and I pulled up and, you know, you got this fuel truck, little car up underneath it, and this guy's on fire, I'm getting them out of there. You know, and just for information, you are covered federally, I believe, by the Good Samaritan law. You know, and you know, Good Samaritan law goes along the line that you did what any normal individual would do in a given situation. Now, has it ever been tested in court? Not to my knowledge. But you are covered by that if you're acting in good faith and working on treating somebody and trying to keep them alive. Could you do harm? Yeah, you could. That's just something, you know, again, if they're in a burning car, you got a kid in a burning car, I'm getting that kid out. Because, you know, he may have some kind of injuries down here, but he's going to be alive. He or she's going to be alive. I actually got sued for treatment on when I was a paramedic one time. But, you know, you do what you got to do. Next slide, please. Personal safety. Kit that I have for you here doesn't have them in there, but put some gloves on. And I think you see that on your list. Somebody takes gloves. Put some gloves on. Okay. Somebody once said that if you say things 3 times, folks will remember it. So put some gloves on. You know, take a second. You know, you're sitting down there, you open up your kid, you're seeing this guy's bleeding. You're talking, how you doing, sir? You know, how you feeling? And put your gloves on. And even when you finish, you know, there's a way to take gloves off. You don't just grab them. You bring them from the end and roll them out to the front. And then you reach under and roll the other one out to the front so you don't touch those pathogens and blood that's on there. Are you going to get blood on you? That's possible. No, so if you get in that situation, even with the gloves, you finish, wash them real good. You got blood here, you know, wash that real good, obviously. And because you know as well as I do all the pathogens that are out there nowadays. Okay, let's see, next. All right, so some basics on bleeding control. Just keep going, John. There's escalation levels depending on the type of bleeding that's out there. The first and fastest way to control bleeding is direct pressure. You know, you got the gloves on, you got a wound here, just putting it down on there. And then as you know, if somebody comes up to help you, then you can start getting the stuff to start wrapping. Packing a wound. There's certain, you'll pack a wound, and I'll show that to you. We won't practice that one, but I'll show that to you. You'll see that a lot, like with gunshot, like severe punctures or something like that. You know, like in the neck, the arm. You can't pack a wound here because there's too much space inside there. But the packing wound is basically just pushing the gauze down in there until the bleeding is controlled. and then obviously a tourniquet. Now, while I'm thinking about it, how many of y'all have heard that if you put a tourniquet on, you should loosen it about every 2 hours or every 45 minutes? Because when we first came out, when I was in the service, that's what we were taught. How many of you heard that putting a tourniquet on is going to mean the loss of a limb?
Heard it.
Yeah.
Yeah, we've heard it.
that.
It's not true. You know, tourniquets, typically you leave a tourniquet on, you don't take it off. You let the hospital take it off and stuff like that. Tourniquets have been shown to be viable without any damage for up to, and in some cases exceeding 2 hours. So anywhere around here, they're gonna be in the hospital in 2 hours, or a lot less than that. So you put one on, you leave it on. You don't loosen it, you don't take it off. They're not gonna lose a limb or anything along that line.
To reassure somebody, tell you, my arm's numb.
That's good.
That's good.
Yeah,
You see how nothing's spurting? That's what it's supposed to do, you know? I mean, have y'all ever had a tourniquet put on just in practice or anything?
Oh, yeah.
when you
Yeah,
get
they
your-
feel real good when they get tightened down. You know, imagine packing a wound, sticking your finger down in there. That is gonna be painful for the victim. A tourniquet is painful. So if they're conscious, dude, sorry, but this is gonna hurt a little bit.
Now, yeah, this is gonna hurt.
A lot, yeah. But pain means you're alive. Next slide, please. So, next one, please. So let's talk a little bit about direct pressure. Any of y'all ever bandage anybody?
Yeah.
Yeah, you know, is Band-Aid direct pressure? Yes, it is. A Band-Aid is direct pressure. You cut yourself, you put that little pad, you tighten it down, that's putting direct pressure on that wound. It's the simplest form, other than you know, we all cut ourselves. That's the first thing we do, right? That really is not good. There's a lot of nasty things in your mouth. But yeah, a Band-Aid is direct pressure. Anybody ever use 4x4 gauze and roller gauze to wrap somebody up? That's direct pressure. So what kind of wounds would you use that on? When would you start off? I mean, we start everything with direct pressure, of course. What do you think?
Scrapes, cuts, superficial type stuff.
Yeah, cuts, and some of them could be severe. You know, I mean, I've worked wrecks where, you know, they were cut all the way down like that. You got arterial blood spotting, you know, that's tourniquet time.
Mm-hmm.
You know, venous blood, the dark red blood, that could be tourniquet time. But you know, we're going to start with direct pressure because it may, you know, even on the arterial blood, you start with very strong direct pressure until that tourniquet gets put on there. There's anything that we can do to slow it down is going to take care of it for you. So, you know, borrow you for a minute? So when we're talking direct pressure, you know, your kits and your trauma kits, you know, forget the Band-Aids. Everybody knows what a Band-Aid does. You know, some kind of sterile gauze, some kind of roller gauze. And I can tell you, in severe situations, you're going to use a lot of this. You know, because you got to wrap above and below the wounds, right? I mean, if I just wrap over the wound, what's that going to do? Is that going to literally stop it? Because I got to get pressure above and below and directly on top. Does that make sense? And so, like, if he's got a wound here on his arm, so, or you know, on his nose, don't put it on his nose. That wouldn't hurt. But when he's got a wound on his arm, well, that's just for a second. You got your roller gauze. Okay, I can roll it like this, or you can try rolling it like that. Now think about it. If I'm rolling it, which is easier, like that or like this? Option A, right?
Yeah.
So if you get mixed up and you start rolling it like this, when you get around that wound, twist it. And then that twist is going to push down on the wound, and then you can tighten it further up with the gauze itself. Because all of us, including me, has started rolling it backwards. Okay. So if you do end up, you've got direct pressure here. And you can just start, and you're going to want it tight and just overlapping it above and below the wound. You're going to get down in here someplace, just start going back the other way. And then when you get to the end of the gauze, tape it. If you don't have tape, you can always rip it, one side up under the other and tie it off. Now, are there any places that I should not use this?
My neck.
Yeah,
Well,
I mean, I really don't want to put something real tight around here, right? But if he's got a wound on his neck here, I can wrap this away
under the shoulder.
under his arms. Now I'm gonna need more than what I have here, but you can wrap under his arms. Same thing in the back. I can wrap this away in an X form. The hard one is up here.
Yeah.
You know, because I don't know, they used to train that if he's got a wound up here, you put the gauze and then you just kind of flip flop back and forth. Well, that doesn't put any pressure.
Yeah.
It's like putting a little cap on. So here, you may have to go up underneath the chin, you know, but the main thing is to get the pressure there. What if it bleeds through? Well, let's take it off and start. Yeah, just put more on. And more on and more on. And if it keeps bleeding through, not a head wound, let's say an arm wound, maybe I need to start looking at a tourniquet.
Tourniquet, yeah.
You know, and that's what we was talking about at the very beginning of this thing. You got to constantly evaluate the person that you're working on. You know, on most wounds, that'll stop it. Or at least the second layer will stop it. But that's why you have those different escalation levels. Does that make sense?
So sounds like you carry a lot of roll gauze.
I do. I've got 2 kits in my car. And 3 or 4 kits in the house. I've got my backpack over there, which got a lot of gauze and other stuff. And then I've got one about like this that, you know, they're all for trauma. But yeah, I mean, I've been carrying stuff for 50 years, you know, ever since I was paramedic. God, it's paramedic 50 years ago.
So what do you think of Quick Lot?
I'm old. Quick Clot is cool. It's expensive, but Quick Clot will work. You'll pay about on Amazon, I think, like $9 or $10 or something for a 2-round pack or something like that.
Yeah.
It works. You know, I don't buy it because I don't make that kind of money. But you know, I run the medical side of our church security team as well, and we bought Quick Clot. But you're still doing the same
Yeah,
thing.
you got,
You're putting it and you're wrapping it. So you're still doing the same kind of things. Make sense? Question. That's direct pressure. Now, while we're here, yeah. So what I want you to do is very quickly open up your kit and each of you practice on each other. You got a wound on your arm. And let's wrap it up.
The Jeremy left, same as the fourth one.
Now, I don't know if I put roller gauze in all of those, but you have the elastic gauze. That you elastic will work. Yeah, that works.
Ace on the case.
There's one. Sorry.
That's good.
Says like this.
David,
Yes, ma'am.
what's this?
That is a triangular bandage.
all right.
We haven't talked about that yet.
Oh, yeah.
Pressure check.
Yes, I am.
All right, I got it.
I got enough blood pressure right now.
This is the best.
Yeah, that's great. That's perfect.
Totally agree.
The ace bandages are amazing.
Yeah, they are. They are. They can do just about anything. Now they've got the tape at the plastic.
Yeah,
Yes.
that's this way. Pressure.
Did any of y'all notice on the list that I got duct tape on your list?
Yes.
Yes.
You wonder why?
No.
Duct tape will stop bleeding in a heartbeat, man.
So we all like.
So electric tape, yeah.
Then you'll have a problem.
But you know, use duct tape, you just follow along, you can do anything with duct.
Baling wire.
No, don't do baling wire, that's never good.
Barbed wire.
Baling wire is not good.
That's good. That's a good tourniquet.
You know,
Razor wire's the best.
I'll say.
You can roll it and stay, you can keep it tight. There.
The bleeding
Don't
stuff.
sell to anybody.
That'll work.
Right there.
Cool beans. That looks good.
That's good.
See, direct pressure is the easiest thing. It's easy to drop it on. Sorry, Jack.
Mr. Jack. Every.
Hi, Jack.
Just.
In the last month, I've seen 2 cars spin out on the highway. And I'm just thinking about. Those, we're talking the impact is 270 miles an hour,
Yeah.
so. It's really hard to tell if those people are, they're sitting there, they're definitely in shock.
There's.
No doubt
Oh,
about
yeah.
it, instantaneously, they're in shock. And. The processing neck industry, dear God.
Yeah, it's different.
And yeah, you are in a little, talking about situational awareness, yes. That 8,000 truck is coming down.
Yeah,
Fast
He ain't
enough.
gonna stop.
and when you have, if they're in the car and you have to try to crawl in the car.
Yeah.
with them, or through the window or something. You gotta be aware of what's going on around you.
One of the most dangerous things is be out on foot. On or on the
Oh, yeah.
Accident scene, and it's like, you're like a pinball up there getting ready.
Well, and the other thing, I don't know if you're aware, I learned this when I got an ambulance. Out drunks, DWIs,
Yeah. they
are
go
drawn to the reds and
They go
blues.
to light,
They'll go to the light.
they go to the lights,
Every single time.
yeah.
Oh, that's the drunks that do that.
Yeah.
And they never get hurt.
Yeah.
So questions on direct pressure? That's the easy guy.
But it really does work the best,
Oh, definitely.
and immediately.
That's why that's why it's first in your wheelhouse. Just been,
How many feet long?
I don't know.
That's probably about 9 feet.
Now, the list that I put on your list there, you'll see, 4-inch roller gauze. A lot of it is clean. You can get a lot of it on Amazon. Does it have to be sterile? No. You can buy a 100-roll pack of 4-inch clean or roller gauze on Amazon for like $11. And it comes already wrapped and shrink wrapped and everything else. You can buy the 4x. Do the 4x4s have to be sterile?
Yes.
They should be. Do they have to be? No.
Well, you're not gonna not do it just because it's,
Yeah, they can take care of the infection back at the hospital.
yeah.
You're more trying to stop the bleeding.
I'm trying to stop the bleeding. So, I mean, because the deal is, if you've ever seen the packaged 4x4s, they're in packs of like 2 pads in there. And if I got a bleeder, I want this much. I don't want this much and have to spend time opening up 5 of them, put on top of there. So like on my kit, you open up my bag, I've got them in baggies. And I've got them in stacks of about like that in baggies. Open up the baggie, boom, and I'm off and going. But you just got to kind of figure out what's going to work best in an emergency situation. Combat, we'd use dirt, put dirt in there to pack it. They can treat the infection at the hospital. Now, should we be sterile? Should we be careful? Of course we should. We used to use super glue.
Super, that's a good choice.
Super glue is a good choice. Hurts like heck when they take it off at the hospital, but it stops the bleeding. Same thing with duct tape. Duct tape does not feel good when you get it peeled off of you, but it'll stop the bleeding.
It works good on airplanes too.
And they don't even squawk.
No.
So everybody good?
Yeah.
Any questions? All right, next slide, please. Or next, packing wound. Let's go to packing a wound is going to hurt. And it's going to hurt a lot. What you'll see a lot of times in packing wound typically would be like a gunshot, a knife wound, some kind of penetrating wound. It may be big, it may be just the size of a 22. But if the direct pressure is not going to take care of it, then packing a wound in some cases is going to be your next step. Now, there's certain areas you can't pack, but you got to be careful when you're packing, because as you're pushing that packing down in there, you got to be careful. There could be broken bone fragments down in there,
Bullets.
and bullets and all that other fun stuff that's going to cut you. So you got to be careful with that kind of stuff. Next slide, please. Do not pack chest wounds, abdominal wounds. Why not?
There's a whole way.
As you said, a lot of open space.
A lot of open space. I've got more than most. There's a lot of open space here. Packing wound is gonna go straight down into the wound. You can't pack this, because every time you start pushing gauze, it's just kind of moving around, you know? So those kind of wounds, you're gonna do direct pressure. One thing that's not on your list is abdominal pads. And they're about like that, of thick gauze that you can use for abdominal wounds.
Question.
Yes, sir.
I know we touched on that quick clot, so if you have quick clot, this is what you would use to pack the wound with. the
You
gauze.
could, very easily.
Yeah, it works well.
Yeah, it works very well. QuickLot is a good thing. It's expensive. And there's a lot of different brands out there. But what they've done is treated 4x4 gauze or roller gauze or what have you with some kind of chemical or something that its whole purpose is to clot. Not blood clot, but to clot wounds. It's exceptional. It truly is.
Not.
Huh?
So I assume it has a shelf life?
I believe so, but you know, you can check that. I mean, even this stuff has a shelf life. I found one of my old trauma kits in the closet when we were repairing our house, and I opened it up and had the old roller gauze.
Yeah.
It was yellow.
Okay.
I said, okay, we're gonna use that for training, you know, but could I use that in an extreme situation? You bet.
Get something like the quick clot pad stored in your trunk in 110-degree temperature.
Good point.
It's a good point. And so on stuff like that, you know, first take a look, does it have a shelf life?
Yeah.
And I think it does, but does it have a shelf life? And just kind of rotate that stuff out. Like my kid, well, none of my cars have trunks. I got 2 trucks, you know, the Expedition and another one, but you know, that's just something like you'll see on your list, Vaseline gauze. Okay, Vaseline gauze is used for puncture and sucking chest wounds. You know, because you put the Vaseline gauze on there and that Vaseline kind of seals it, and you tape it on each side. Well, Vaseline gauze in Texas could get a little crazy, but it's packaged in such a way to protect a lot of that, especially from like the UV and the heat. Well, nothing's going to protect it from the heat, but you know,
Yeah.
even opening that up, it's still viable. But that's why you also see saran wrap on your list. Because if the Vaseline gauze, if you don't have Vaseline gauze and you've got saran wrap, you can still put that over a sucking chest wound and tape it. And it's going to seal that wound and help them to breathe.
If you did that press and seal.
Yeah,
You can also use the 4x4 plastic,
that's right.
you know,
That's absolutely right.
take them out.
Anything that's going to create a airtight seal. But y'all know what I mean when I say a sucking chest wound? Have y'all heard that term before?
I heard it, but.
No.
Okay, what a sucking chest wound is like you may get a gunshot or a puncture here. And it kind of, you'll hear it and you'll see it. When they breathe in, you'll see like little foam come out and they're having trouble breathing. You can turn them to one side, don't turn them that way. Turn them to where the side is down if you can turn them. And very often there won't be an exit wound. And so you have to plug that hole so they can breathe. And so what a Vaseline gauze will do, it'll go over that hole and the Vaseline will seal it. And depending on your school of thought, you'll tape it on 3 sides. The 4th side is going to have like a flutter valve.
Okay.
But you'll also see some folks that say tape it on the 4th side. But, you know, I've always trained and been trained to tape it on 3 because when they exhale, it'll act like a flutter valve. But if it's Vaseline gauze, it's going to seal, but you can still function that way. And so that's why the Vaseline gauze and the saran wrap are on your list.
So a wound like that, you want wrap, you
No,
would tape.
you just put it on there and tape it. That's not something you're going to wrap around.
Okay.
Yeah, so neck, chest, or chest wounds, abdominal wounds, you're gonna use direct pressure. The areas that you're gonna pack wound are like neck, armpit, groin areas, or any wound that's you can't control with a tourniquet. You know, because again, we're not gonna put a tourniquet on our neck. If I get injured up underneath here, there's not really a place I can put a tourniquet. Same thing if you get injured in the groin. You know, you can't put a tourniquet there. So that's where packing the wound is gonna come into play. And again, packing is gonna hurt. Now, to pack one, can I borrow you for a second? You can use roller gauze. Now, you'll see on your sheet a Z pack. A Z pack is about this big by that big. And it unrolls like a Z.
Okay,
That's it.
accordion type.
Yeah, of course, that's the word I was looking for. But you can use gauze as well. And basically, I'm just gonna have him do his hand like this. Here's the wound. Okay, so when you're packing, I'm just doing that now. You're pushing it down in there like this, and you're holding on that wound. And then you're just kind of exchanging and just kind of poking that down in there, one top on top of the other. Until you're gonna get to the top, just keep packing and keep packing. Because that's causing direct pressure right at the wound. And the gauze around it could help start controlling the bleeding. Okay, and again, you never take this out. If it gets packed and the bleeding stops or slows down, now I've got that. Now I can wrap it with direct pressure. Okay, because again, even here, up underneath here, or even here, it's gonna be hard to wrap that. You know, I mean, could I take roller gauze and go this way? Sure. But that, by the time you finish packing, EMS should be there. You know, hopefully. But, you just gotta tell them, this is not gonna feel good, my friend. You know, because again, you're sticking your fingers, your gloved fingers, into their body and pushing down on something that just entered their body. And that is not gonna feel good.
So situationally, you're out somewhere and you don't have a trauma kit with you, you have to pack a room. What do you avoid packing? Is there a definitely don't use this list or?
I'm gonna pack it with anything I can to stop. Now, am I gonna grab a bunch of leaves and crap like that? No,
Obviously.
no. Am I gonna maybe cut a strip off his shirt? You bet. You know, because again, I mean, leaves, dirt,
Not for sure.
Right.
not first choice. But if, how many of y'all carry a pocket knife? Sorry about your shirt, dude. And start packing it down. And then just keep going until you can't go anymore. And then go a little bit more. Does that make sense?
Yeah.
So that's the second phase. Next slide, please. Thank you. Or if you want to stay put, I can show it. Forget that. Tourniquets, last resort. A lot of folks are trained when you apply a tourniquet, we heard, high and tight. If my arm is amputated here, I'm going up here with the tourniquet. High and tight. And there's also 2 to 3 inches above the wound. There's no definitive right or wrong there. I was trained high and tight. But would I do that? Probably not. It just depends. Because if I've got to put a second tourniquet on and I'm here,
No place to put it.
there's no place to put it. Now I got to try to go above it, but this one's already not doing the job. So if I'm high and tight, I can kind of work my way down in applying these things. Okay. Now, what if I don't have one of these? Well, when you're on Amazon, there's a lot of different levels of tourniquet. The blue ones are training purposes. They're not good. Like the ones that are in your kits here, they're blue. Those are for training. Tourniquets are not cheap. You get a good cat tourniquet, which is one of these guys, it's going to cost you $12 to $15 each. Okay. And they're single use only. Because you can't follow EMS. Okay, give me that one back and put yours on. That doesn't work that way. They're single use only.
Stock me up.
This thing is going to hurt. I mean, there's no 2 ways around it. It's going to hurt. So once you put this thing on and you cinch it down and the bleeding is stopped, you'll see this little, and And he added, something you want to add to your list is an ink pen or a magic marker, because you want to put the time that you put the tourniquet on here. Pardon me. So these guys, again, whether you're high and tight or 2 inches over, if they've got light clothing on, that's cool. If it's winter time and they got their winter coat on, I'm gonna cut that coat off or take the coat off. Okay, so when you have these, when you pull them to open up, they're pretty well ready. I mean, you can always expand it and what have you. Sometimes you may even have to run it through this thing, senior brain fart. Okay, the buckle, yeah. Okay, but when you go to apply these things, if it's a very large limb, you may have to unstrap it and then run it back to the buckle accordingly. Okay, but most of the times you can just pull it apart and it's going to be big enough to apply. And then when you're going to apply, let's say the wound is here, cinch that thing down. Don't put it on a joint. You're going to break it and it's not going to get the tourniquet. You pull it down, then you just kind of cinch this and you pull it tight. And it's going to stop, over on the other side. Let me get that thing out of the way. You got your bar, okay, your torsion bar. Normally, you're only going to have to turn that thing 1 or 2 times, up to 5 maybe, to get the bleeding to stop. Once that bleeding stops, you'll notice on a tourniquet, it's got a little clip bar right there. Put that up underneath there, the bar, finish wrapping this over, and then your time is going to go right over there to keep everybody in place. Can you see that again, or does that make sense?
Makes sense.
Good. And no, I didn't type it down. But, when you're doing this, because I think I just went 1 time.
You did 1 turn.
Yeah, I just did 1 turn, and in here, just do 1 turn, because this thing does hurt. And then, if I got to put another one, I'm going to put it down below. That's why I always, I go high and tight. All right, so now work with each other on that. Now, one of you may not have a tourniquet. You may have a plastic thing, this plastic.
Oh.
Yeah. This is another form of tourniquet. Okay, all eyes up here just for a second.
Back up.
Get it.
This is another form of tourniquet, these elastic bands. Okay, these work just like you're doing direct pressure. You're gonna wrap it above, and the tighter you pull this thing, you can pull it down pretty tight. It's hard to do by yourself, and it'll work. What won't work is like you see on TV, give me your belt. And pulling one down with a belt. You can't get it tight enough. Will a belt slow it down? Yes. Will it stop it? No. If you don't have any of this stuff, clothing, a towel, wrap it, put a stick in between it, start twisting that stick.
That stick is the key piece.
Yeah. You don't want a twig.
No.
If y'all want to use that one, that's fine. Either way.
The cat.
Yeah.
Do you have any experience? I told my kids had them twisted. Okay. A rat?
I do not. I haven't even seen. I mean, there's all kinds of tourniquets out there.
Yeah. So that I block that. The only thing I don't like about the rat is there's no built-in, as you're saying, that would help.
Okay, now pull that tight.
I carry these.
Do you get this on?
So if we do need a lab,
Sure. You're getting this right.
and then you double.
And then you got it loose, you're not gonna get that. So you want to cinch that down real good and then you hold it on place. And this way. That makes sense?
The important piece is the bed. Yeah. It's actually. Never bad efforts on. But that's really. The question on that is, how do you lock it?
Who said how do you lock to this?
No, you're talking about the rat.
Oh,
not
the rat,
the-
yeah. You don't get this?
Sorry.
You locked.
You're gonna go that way, so I guess it's very, very.
No, one thing I like about it is you can.
Yeah.
Somebody gets.
Do that.
Cool. Pressure.
I got no circulation in my arms. I'm hurting.
I've heard that about you.
He doesn't need a tourniquet because there's no blood there.
What about that head wound?
Well, that's where it comes in right here.
Turn them into Frank.
Right over here.
A lot. It doesn't make a whole get that stuff.
Yeah.
Well, do it. I guess.
I would equate rat.
Okay, if you could.
Now, is that for tourniquet or tourniquet?
Tourniquet. But you really have to pull significantly to get the, but if you pull it far enough, it will cut it off. Like, see,
And that's the way it always goes.
I got a couple of those, I'll put that, I'll have to move that to.
Yeah, those are good.
Yeah.
You know, and those are cheap. You go buy those training bands.
Yeah,
You know,
I got
those
training
therapy
bands.
bands. That's the same thing.
Yeah.
This is pretty simple, it's just a straight up.
Now- Another thing that you have in your kit is a triangular bandage.
Okay.
Now typically, when we think of a triangular bandage, we think of a sling.
Yeah.
Right? You think of a sling, but I can use this as a tourniquet.
Okay.
You know, I can take this down, I can wrap it around, tie my knot or tie the first part of a knot, put a stick there, tie it over the stick and twist it. And that's going to work as a tourniquet. And it works very well. These were the first tourniquets,
Yes.
other than the cowboy gun belt. Okay, these will work. These will work for direct pressure. These will work for a sling. These will work for splints in some cases, or holding the splints in place. This triangular bandage is very versatile. You can do a lot of stuff with it. Now, let me ask you a question. What should I not use as a tourniquet?
I got a 12-gauge
Rope? Why?
Well, it's gonna cause its own wound, it's gonna be very tight.
It's gonna slice rather than.
Rope, wire,
Yeah, rope, wire, electrical cord.
those are all, they're cut.
You know, those things that are narrow. Because a tourniquet needs to be, you know, at least about an inch and a half wide. And I don't know of any cable that's like that. Don't use tie wrap.
Oh, shit.
No, don't, that's the cord.
Don't use bungee cord. Because, you know, so, I mean, a lot of it is common sense. Okay. Because the whole deal is, you know, like doctors say, their whole stuff is do no harm. So think about, all right, I've got this 75-foot copper, 75-foot extension cord. I can do a lot of tourniquets. You know, you're gonna do a lot of damage. Next slide, please. Okay, where not to apply a tourniquet. Joints. Because again, I try to put a tourniquet here. One, it's not going to get tight, and two, I'm going to break his arm or break his shoulder. Okay, so any kind of joints. Obviously, I can't put a tourniquet around here. They don't make one this big. Okay, even the triangular bandage won't work. This is where not packing, but direct pressure is work. You know, so it's always above the wound or high and tight, whatever you want to do is fine. And stay off the joints and nothing from here up, obviously. Questions? Next slide, please. Next slide. Next slide. Okay, that's tourniquets. Now, we talked about falls. All of us have fallen. You know, sometimes we just get a little scrape that I can treat with just washing out some water and putting a Band-Aid on. Or sometimes it could be severe and you break your neck or break your back. A friend of mine works in construction, fell 30 feet, broke his back. Okay. You know, so the main treatment on falls, if you come across somebody that's fallen, depending on it, I mean, they may be trying to sit up. You know, if they just fell off a ladder and they're trying to sit up, hey, relax. Let's just lay here for a minute. Let's do some evaluation. You know, let's check them. Try not to move them, depending on the severity of the fall. And if I just trip here and I fall, you know, maybe I might break my arm or twist my wrist or something like that. But can I sit up with a broken arm? Sure. But until you know that's the only damage that there is, or the only injury that there is, let's just lay still here and let's check you out. Let's make sure that everything's good. And then if this is all it is, then I can support this and help them to set up. But the main thing, you come across a fall, keep them where they are. Hey, let's just kind of be still here for a minute. No, I'm fine. Let's just kind of be still here. And let's check you out. Let's make sure you're okay. Anybody ever fall down a stair or two? Or fall up a stair?
Yeah.
I've seen it on TV.
I work with the deaf at church. And they told me if I ever fell, I would bounce right back up. True story. They told me that. So if they have fallen and they're on the ground, are you okay? No. What does this tell them? I'm lording over you, and that's going to increase their fear and their pressure. Come down to their level. Talk to them in a calm voice because they're going to be scared. They may be anxious and things of that nature. So just everything that you can do to calm them is going to help treat for shock and going to help you better assess what's going on with them. Okay. Talk to them softly, keep them still. Ask them about their pain. Did you hit your head? Like I just asked you guys, how many of you ever fall? Did you hit your head? You see stars? Okay. If they saw stars, what could that be?
Concussion.
Could be a concussion. Okay, at which point I definitely want them sitting still. You know, you have any tingling in your fingers? Yeah, a little bit. What could that be? If I'm tingling here and I'm tingling down there,
That's back. That's the nerves.
yeah,
We got a problem.
I could have broken neck, broken back. You know, squeeze my fingers, squeeze my hands. You know, put your 2 fingers in your hands. They squeeze. You know, if you feel an equal pressure on both sides, odds are they're pretty good. But if I'm tight here and real loose here, I definitely want to be still. We could have a back injury. Does that make sense? So you have to remember how the first slide said, assess your patient, assess the injured. This is what you're doing. You know, you're on the ground. Okay. Did you hit your head? Yeah. You see stars by any chance? You feeling dizzy or anything like that? You feeling nauseous? Because those 3 things could mean a concussion, which point you want them still. Any tingling? You definitely want them still. You don't want to move a fall victim who has any of those situations, because that could be, now, again, depending on the situation. You know, if I'm in a burning house, I'm not going to waste time. You got any tingling? We're going to safe to get that person out of the house. And there's ways to drag that we're not going to go on in here today. Yeah, like I said, you know, you don't want to move them if you don't have to. Let EMS take care of that because they got all the stuff. We want to calm them. If they've got, you know, if this thing is out of joint, I'm going to splint this. If it got bleeding, I'm going to take care of it with direct pressure or whatever I need to do. You treat the ABCs. Okay. And you treat the fractures. Anything other than that or bigger than that, tingling, what have you, they stay put. Same thing in a wreck. Any of y'all ever get rear-ended? How's your neck feel? It hurts, right? Especially the next day.
I was gonna say that. Never when you're amped up.
Yeah.
Next day, oh God.
But could that be a concussion? Could that be a neck strain? Could that be some type of neck injury? Of course it could. You know, you come across somebody and they're in their car like this. You know, that's where you start talking to, hey, EMS is on the way, you know, where do you hurt? Because a wreck is a violent fall. Boom, I'm falling. Make sense? Next slide, please. And I know that's hard to read. When do I call 911? One, I don't move them. Now, if I just tripped and maybe, you know, sprained my finger or sprained my wrist, do I need to call 911? It depends. Do they have any of this other stuff? You know, I mean, we've all fallen and sprung a finger or sprung a wrist. We get up, we're fine. We just wrap it. We go to the doctor, we're off and running. Do I need to call 911? Probably not. But that's where you start assessing the victim. You know, are they breathing? Remember, ABCs are first. If they're unconscious, right now, I'm calling you, call 911. And then you can down, sir, can you hear me? Everything okay? Did y'all ever do a sternal rub? They hurt. You don't want to do it nice and easy. I'm gonna, you know, get down in there. If they start, okay, just now you know they're moving, they're breathing, their heart's beating. Okay, all right, that's a step. If they're not breathing, you're starting CPR. Check the, you know how to check the pulse? Take your two fingers, put it on the right side of your neck. Now, here I am, I'm checking my pulse. What does this look like? Versus this? What's that look like? Choking. Like if this gentleman is down and I'm checking his pulse here versus here, what's that look like? You got John Q. Citizen coming up and I'm like this.
Right.
Yeah, and I'm choking this guy and he's gonna bop me upside the head.
And then we got two victims.
And we got two victims. And when I wake up, we're gonna have three victims. You know, you can feel your pulse. Are they breathing? Shallow, but they're breathing. Have they got a pulse? Yeah. Okay. ABCs are good to go.
Just make sure you're not doing it with.
Yeah, your thumb has a beat in it. That's not checking a pulse. That's not checking a pulse.
Your pulse.
Sir?
Your pulse.
Yes, your
Yeah,
pulse.
that's a.
Yeah, your thumb has a heartbeat in it. Read that big up. Is there, you know, you come up on their phone, their lips are blue. And they're getting kind of pallor in their skin. What happens if, why do your lips turn blue?
Lack of oxygen.
Lack of oxygen. So even they may have very shallow but labored breathing. Do I need to do rescue breathing in that situation? Not necessarily. As long as they're breathing, I'm good to go. Okay, but if their lips are blue, odds it was enough breathing. You may not have to do CPR, but you may have to do rescue breathing. You just gotta have to assess which is which. A cut or a burn that's large, deep, or that involves the head, I'm calling 911. I'm gonna treat the wound and call 911. Any fall from a height, any confusion, vomiting, poor skin color. We're talking concussions, right? Seizure. Any of you guys ever see a seizure?
See a lot of fake ones.
Huh?
See
Only
a lot
on
of
TV.
fake seizure.
Have you ever seen a real one?
Yes. Much,
Those son of guns are scary.
much more calm than the fake ones.
Yeah. Yeah. A seizure is a scary thing to watch. What can you do on it? Say this guy's having a seizure. Okay, I want to put a belt in or a pencil in between here and stop him from biting his tongue, right? Well, one, his teeth are going to be clamped. You're not going to get a, do not put your finger anywhere near their mouth. You want to maintain an airway till that seizure stops. That's all you can do.
Fine.
Don't try to hold them because the seizure could be violent. That holding them could break a bone. Just maintain an airway. They're going to urinate themselves most of the time. They may even defecate themselves sometimes, but they will urinate themselves. And when they wake up, they're going to be confused and disoriented. That's called a post-ictal state. That's normal. Doesn't mean they have a concussion. That's normal for post-seizure. Just maintain their airway, keep them there till the EMS arrives. Any degree of non-responsiveness. Sir, can you hear me? Yeah. What's your name? You know where you are? At work? No, you're on 360. And there's cars gonna run over. Get up and move over. You know, any degree of unresponsiveness could be a concussion. Can't bear the weight. They tripped. You don't see any deformity in their leg, but when you try to stand them up, they start this kind of stuff. Could be a fracture. Are you always going to see deformity in a fracture? No. Maybe a little swelling, but maybe just a little swelling. That's where palpating comes in. You know, if they've fallen, you know, check them. Do a head-to-toe exam. Does this feel okay? You know, start, you know, because you can feel a fracture, but there may not be any swelling, may not be any deformity, but you can feel that little lump right there. Let's sit still for a little bit. And even if it's not a fracture, even if it's a sprain, because a sprain is going to swell up too, I'm going to treat it like a fracture. Do you have x-ray eyes? So I don't know if that bone's broken or not. We're going to rip it up. Yeah, any excessive swelling, stuff like that. Okay, next slide, please. Signs and symptoms, typical signs and symptoms of a fracture. Pain at or near the site of injury. May not be swollen, may not be deformity. But when I start pressing right here, okay. Y'all ever do that? See that? Not fun. Difficulty or impossible to move normally. Now, if you suspect a fracture, don't say, can you raise your arm? You know, but maybe can you wiggle your fingers? Support this, can you wiggle your fingers? If they can, that's telling you at least the nerves aren't damaged. They've got good circulation. All I got to do is treat this. Loss of power. Squeezing both sides. Nothing here because I can't squeeze. Could be brain, could be a fracture, nerve damage someplace. Deformity, obviously. Tenderness. Ouch. You know, swelling, of course, discoloration, bruising. And I know this is hard to see on the slides, but can y'all see the top one there? He just got a little swelling right here. The one on that side, he's got a good lump right here. Broke his wrist. And that was kind of obvious because his arm goes like that. You never know what you're going to look at. Any you ever broken a bone? I can honestly say I've never broken. Well, I broke my kneecap, but I couldn't see it. Okay, next slide, please. This is hard to read, and I apologize for that. But basic treatment. Obviously, ABCs. That comes first. Treating bleeding, airway, circulation issues, and stuff like that. Open fractures and closed fractures. Closed fracture is like the images that you saw. An open fracture, there's a bone poking through. Yeah. Do not push the bone back in. Don't even try. One, you're going to hurt them like crazy, and two, you're going to do more damage. Treat, you know, direct pressure is going to push the bone back in. So you may have to do something above or below that, and then splint. If a bone is protruding, obviously you don't want to cover that because the docs need to see that. Okay. Use a splint to immobilize above and below the fracture. If available, cold pack. I don't know if I put that on your list or not. Now, if you do use a cold pack, anybody ever use a cold pack before? What's it feel like if you just put it directly on your skin?
It's cold.
It's cold. It's going to freeze your skin. So if you do use a cold pack, put something underneath it. Because that thing gets freezing cold and you can cause damage to their skin and cause further injury. But the cold pack or ice or something like that in a bag That helps reduce the swelling and helps control the pain. Look for signs for shock, we talked about, and then wait till help gets there. You're gonna stay put. But I'm fine, no, you've got a broken arm, broken leg, whatever, you're gonna stay put, EMS is on the way. Next slide, please. Let me ask you, what can you use to make a splint?
Damn, you're right.
Pretty close. What's some examples,
Stick.
I already showed them.
sir?
I already showed them.
You wanna.
You cheater.
Newspaper, right there.
Pencil.
Cardboard.
Well, yeah, let's see, I can use cardboard, I can use magazine or newspaper, you know, a pen. All right, let's talk about that. What can I splint with that?
Fingers, toes.
Finger. Now, if you do have a broken finger, you can splint it or just take the two fingers together. Or the three fingers together, or the two toes together.
Yes.
And just doing that, even without this, will splint that because these two guys are gonna keep that guy stable. Okay, newspaper, cardboard. You got cardboard? I mean, they don't even have newspapers anymore. What about magazines? Remember TV Guide? Magazines, cardboard. You can even roll up a towel. You can use a towel for it. Anything that's gonna support that thing. Ironing board. Maybe not. What could I use an ironing board for? Back, legs. You know, because some ironing boards are, 6 feet long. Some are short. I can use that to splint a leg. Broom handles.
How would you do a pillow rigid enough to actually make it worth?
A pillow, it is similar to the roller thing that we have here. To this guy. Because a pillow or a blanket, I would use a pillow for broken ribs.
Okay. That
Okay,
makes sense.
because broken ribs, like a pillow or a blanket or something like that, if the ribs are broke, because you can't split these. But I can, if I've got a broken ribs, I can put that pillow here and then wrap it.
Okay.
And that's gonna support my ribs. Now, you gotta be careful, don't wrap it extremely tight, because those broken ribs are sharp and they could puncture a lung. But I can use that to support, at least until EMS gets there. Does that answer your question?
So along the same lines, what would you use rolled up?
Same thing.
Just,
Yeah, like, go to the next slide, please.
see, when I think split, I think rigid.
See, like, I know this is hard to see, but this is one of these guys that you can wrap around the foot. Okay, I can roll up a blanket and I can wrap it above and below here, or wrap it above and below my leg and tie that. Now, are we talking one of these little itty bitty throw rugs that, no, we're talking about a blanket. But if that's all I have, then I can roll that thing up and I can, just kind of wrap it like this and then roller gauze it. And that'll help support it.
There's your pillow.
Right.
Just wrap it
I
around.
can also bend that pillow. So you can use a pillow here, I can use a pillow, I can put a pillow up underneath here and wrap that, and that pillow is gonna support it. Even a feather pillow.
When I hear split, I'm thinking rigid. You're
Yeah.
thinking more just support in
Yeah,
general.
because you may not always have something rigid.
Right.
My mom fell and broke her arm. I didn't have my kit with me. I used a magazine. And I didn't have any rollers, so I used kitchen towels to tie off the magazine.
Okay.
You gotta get creative. But the main thing is just to keep it supported. Because we all remember the old air splints that you could blow up and everything. And they were nice until you tried to put one on. Because they were compressed and you had to pull that thing over. And when you pulled it over, it hurt like heck.
So not necessarily fully immobilized, but supported.
Supported, yeah.
Okay.
If you can fully immobilize it, then yeah.
Right.
But if all I can do is get it supported to where the bone isn't doing this,
Okay.
I'm good to go. Because EMS will get there, they will leave that in place. And they will transport like that, most of them will.
Okay.
So I mean, you can use just about anything. Now, I've got a lot of stuff up here. You know, this thing, you can get this on Amazon. It's kind of big. Okay, but it'll fit in your kit. Depending on what you use. If this is what you have. Where you can. You unroll this thing.
Pay for that, Josh, don't worry about it.
I get a raise again,
Yeah.
double my pay.
So if his arm is broke, am I gonna do this? No. I'm gonna measure it. And do this. Okay, we're gonna act like this is his foot. I'm gonna do this, or his leg. I'm gonna wrap it like this. That's what you see here. These things are real versatile. And they're rigid, but they're soft. So I can kind of bend this thing to whatever I need. And if you're doing like a broken hand, see how I left this here?
Right.
I can be just like that.
Julie's got a question.
Yeah, Jim.
I was just gonna say, one of the diagrams here shows, with the center bending that thing around the elbow, because you're squinting the arms this way.
Yeah. Absolutely, like this.
Yeah. Or around the elbow and then back down towards your eye.
Mhm. Yeah.
You know,
Yeah. But it depends on what's broke. If I've broken my elbow, that might work. Or that might work.
You're up, you, a bandage with their A's over there.
Yeah, I'd wrap this with a bandage, yeah, because you gotta wrap to keep it in place. That's one that I have. You can just pre-wrap some. That's a little 1x. If you got nothing else, got these guys. Put some gauze over the top of them, put it up there, and you're off and running. And I carry this one time when I had surgery. Yeah, so, and you can just put these on and wrap them up. Make sense? The main thing, main thing on fractures is to try to get them to where they're immobile, so no further damage is done. That's the biggest thing.
So in a situation like a wrist or an ankle, if you have one of those braces that has the Velcro strap on
Mhm.
versus something like that, would you want to use something like that, or would you risk causing more damage? And
Well, that's the whole second part of that. You know, if my ankle is broken, my foot is like that, I'm not gonna use one of those. But if my ankle is broke or sprained and it's straight and my foot is normal, maybe. You know, cause like I got 4 or 5 of those, the boots. Yeah, I got a bunch of boots.
plenty of wrist braces.
Yeah. And you know, that was a wrist brace that I used on me. I carry that in my kit.
Right.
I don't throw anything away.
Right.
These things are kind of big, obviously. And they will take some space in your kit, but they're very versatile. But if you don't want to do those, it just gives you a 1x and wrap it up. I mean, it doesn't even have to be that thick. It can be that thick. You know, or throw a magazine or something in your kit. Anything that you can use that will sturdy things up.
It's one,
Huh?
just one.
Hey,
You
how
can
are you?
do two.
No, this one's enough.
You can play for a leg.
There's a lady downstairs that says she talked to somebody about possibly giving them an old radio.
Don't know, but we'll.
Yes,
We can talk.
we'll take
we'd love to talk to her.
Okay. She said she talked to somebody with HurstARC Radio Club and said that they meet here on Saturday morning.
Send her a
30 of us, so.
She down in the bay?
No, she's
So like,
outside the gate over
Out
here.
at the gate? Okay. I'm with you.
see how it's closed, like if you're broken. She said this.
I was like,
There is.
I was thinking more than what was there.
Yeah, I mean, this is too small for a leg. But, yeah, that's good. You get that, but again, you're going back in. Now, leg splints, are different. Nothing that I carry in my kit is gonna cover a broken leg.
Even that thing.
That thing will, if it's the lower part of the leg, you know, but if I'm broken up here or I've broken my femur, that ain't gonna cut it. Okay? Because the thing you gotta be careful of with a broken femur is the biggest bone in the body. And right next to the femur is the femoral artery. You clip that femoral artery, you can bleed to death in about 30 seconds. It's that fast, because that's the biggest artery in the body. And so, you know, you'll have to put pressure here again, because if this artery, if it's exterior, yeah, I can treat the bleeding. It's an open fracture. If it's interior, I'm gonna have to put severe pressure right in there. And my hand ain't gonna do it. I'm gonna put my knee right here and put all my weight there to control that bleeding. Again, it just boils down to assessing the patient. Good? Questions? Next slide, please. What's wrong with that picture? Is there anything wrong with that picture?
It looks like you can get cut.
Yeah. What's at that end of that stick?
Point.
A point. Where does that point? It's right there. What's underneath there? Arteries.
It looks like it's trying to be.
And there's damage at that end too, yeah. So, you know, we heard stick used before, but you gotta be very careful what you're doing. You know, would I ever use that as the last course? But I'm gonna try to get those points taken care of, because I'm not gonna put those into somebody's arm or leg, or worse, up in the groin area. That would hurt. Next slide, please. All right, so assess, check for pulses. Broken here, your distal pulse is your wrist. Broken leg, your distal pulse is right on top of, you know how your foot bends? If you put your two fingers right, you'll feel a little indent. That's where your distal pulse is. You can feel the pulse in your lower leg. Expose it. If I've got a long sleeve shirt on or a heavy coat, I might have to cut that. You know, I had that happen. I wrecked my squad car one time. I had a brand new pair of boots. I had just bought them the day before. And my leg was trapped in the car. And they had to cut those boots off. I was not happy. But splint in the position found. I'm broken like that. Don't say, okay, let's splint it. You splint in the position found, because what's that going to do? That's going to hurt like crazy and you're going to do more damage. Because right there, these vessels might not be cut. That just cuts your blood vessels. So splint the position found. Pad it, top and bottom if you can, and secure it. Wrap it up. Which is another reason I say that your kit should have a lot of roller gauze in it, or the ACE wraps, or something like that. Next slide, please. Do's and don'ts. Do, I know it's hard to see. Immobilize above and below, add the padding and check the circulation. That's what we talk about. Don't move anything or tie it too tight. If you are going to be using the ACE wrap, and ACE wrap is really good. ACE wrap is elastic. You can start wrapping it real tight, and you've created a tourniquet. You know, for a broken wrist, you've just created a tourniquet. You just want to secure it just enough to keep that splint in place. And, you know, if you put a splint on somebody, you know, if you take that splint and do that with it, that's not tight enough. So you put it and you just wrap it until there's no movement, and then you're good. Okay. Next slide, please. Okay, we can't do these because the videos don't work. Any of you guys ever see an AED? Ever get trained on an AED? Know what they do?
AED or walking.
Yeah, AED will tell you step by step. You turn it on. Put this pad here, put that pad there. Get everybody away, press analyze. And it'll tell you to shock or not shock. If you shock, it's going to tell you get everybody away. Hands off. Because if I'm touching that guy and it shocks him, I'm getting shocked too. And a counter shock can kill you. Because my heart's beating good, and all of a sudden, boom, my heart says, "What was that?" And it starts going off in all kinds of different directions. Okay. CPR, yes, ma'am.
But do you think, okay, I know people who have a pacemaker.
Mhm.
Do you have to check for something like that before you consider monkeying around with more electricity?
You won't be able to know.
You really, I mean, you really won't know. I mean, because, I mean, I'm gonna open their shirt,
Yeah,
you know, because I can't do an AED patch from here. So you're gonna expose them.
yeah,
And, you know, I've never seen, Jack, is there a scar? Is there's,
no, you can feel it,
Yeah, I can feel it.
yeah.
okay.
But I'll
Because
say this. If you got a pacemaker. And the pacemaker is doing its job,
Then you don't need this,
you don't need it.
No.
Because
it'll keep you,
that, or it's gonna put you on the ground and you're gonna say, thank you, dear Lord, I owe you one.
and that plus typically the pacemaker's on this side, pad goes here,
yeah,
pad goes here and here. And it shows you on the AED where to place them. And he's right, the pacemaker is gonna kick in if something goes squirrely.
It'll flat get your attention, I know that.
It says hello. And the next slide is dealing with PAD and CPR, and we just don't have the capability here to show those. So that's pretty much what I got. Questions?
Thank you very much, great job.
Thank you. If y'all wouldn't mind, put everything back in the bags.
we gotta clean up,
Yes.
it was a free class, what do you want? Good.
Well, I don't have to say the cleanup stuff while I do it.